If you are someone living with inflammatory bowel disease, IBD, and have been managing this condition for many years, you've probably noticed something important. Quite often, whenever you catch an infection, not always, but in many cases, your IBD tends to flare. These infections can include many different types of viruses. The common cold, the flu, influenza, COVID-19, and also gastrointestinal viruses that cause diarrhea, nausea, and sometimes vomiting. Yes, this connection is very real. Why this happens in IBD? In people with IBD, the immune system in the gut is oversensitive and overreactive. It reacts much more strongly than in other people and ends up attacking the intestinal cells themselves, leading to inflammation and damage to the intestinal wall. This means that IBD is not caused by a weak immune system. In fact, it's the opposite. The immune system is overactive, always on high alert, and ready to be triggered. So please remember, having IBD does not mean your immune system is deficient. Even when you feel well and think you're in remission, there is usually some level of silent, low-grade inflammation happening in the gut. When a viral infection stimulates the immune system, especially through certain pathways connected to IBD, that mild inflammation can suddenly escalate, causing a flare. How different viruses affect IBD. Not all viral infections are the same. Some are more likely to trigger a flare than others. Common colds, usually caused by rhinoviruses, are generally mild. They only stimulate specific parts of the immune system, so they rarely cause an IBD flare. Gastrointestinal viruses, however, are very different. These viruses directly attack the gut cells, strongly stimulating the immune system and very easily triggering a flare. Flu, influenza, and COVID-19, especially when severe, can stimulate the immune system intensely and throughout the entire body. That's why with severe flu or severe COVID-19, we often see IBD flares, similar to what happens with strong gastrointestinal viral infections. Why prevention is so important for those of us living with IBD. Avoiding viral infections as much as possible is absolutely essential. This means taking strict preventive measures, even stricter than what most people usually follow. Avoid crowded places, especially during cold, flu, and COVID-19 season. Wear a mask whenever you are in high-risk environments. Wash your hands frequently and thoroughly. If someone in your household is sick, wear a mask and keep your distance as much as possible. Get your annual flu vaccine and stay up to date on COVID-19 vaccinations. And if you are taking steroids or other immunosuppressive medications, wearing a mask in crowded places during peak season is absolutely necessary, not optional. Your immune system is suppressed, and you are more vulnerable to catching infections, and to getting more severe infections if you do catch them. My personal strategy when I feel early symptoms from my own experience, the moment I sense that flu or COVID-19 is spreading around me, or if I notice the very first signs of infection in myself, I act immediately. Here's exactly what I do. 1. Increase my fluid intake significantly, especially warm fluids. 2. I drink plenty of herbal teas, focusing on chamomile and ginger tea with lemon, many times throughout the day. 3. I use my miracle mixture, which I've explained in another video on my channel, 3 to 4 times daily. 4. I add ginger and thyme generously to my diet, in teas, soups, and meals, because they are powerful natural anti-inflammatory and immune-supporting herbs. 5. I take zinc supplements, a vitamin B complex, and vitamin C, 1000 milligrams daily. I continue taking vitamin C every day until my symptoms completely disappear. 6. I completely avoid NSAIDs like ibuprofen, indomethacin, celecoxib, diclofenac, and mefenamic acid. These drugs can irritate the gut and worsen inflammation in IBD. Instead, I use acetaminophen, antihistamines, or mild cough syrups to manage my symptoms safely. Extra immune support when symptoms first appear. I also increase my intake of probiotics, both through supplements and probiotic-rich foods. Boost my consumption of turmeric and olive oil, which are key ingredients in my miracle mixture. Eat light, soothing soups made with plenty of vegetables, a little chicken breast if you eat poultry, and lots of lemon. Keep my meals soft, easy to digest, and nutrient-dense. These steps often help me avoid a flare entirely, or if I do notice mild signs of inflammation, they help keep it from getting worse. Sinus washing. A powerful prevention tool. One of my favorite and most effective prevention techniques is nasal and sinus washing. The main entry point for respiratory viruses is through the nose and sinuses. So if you've been exposed to a sick person, wash your sinuses as soon as possible, ideally within the first hour. Here's how: if you have access to saline solution, use a syringe to gently flush one nostril and let it drain from the other. If you don't have saline, you can make a simple solution using boiled, cooled water with a small pinch of salt. This can sometimes prevent the virus from fully infecting you before it has a chance to take hold. I do this every time I've been in public during peak cold and flu season, and it has made a big difference for me. Vaccination safety. If you are on immunosuppressive medications, please remember, never receive live attenuated vaccines unless your doctor specifically approves it. Always consult your physician before getting any vaccine, especially while taking biologics, steroids, azathioprine, or methotrexate. Final thoughts. Living with IBD means our immune system is always on alert. Viral infections, whether mild or severe, can sometimes tip that balance and trigger a flare. By taking strict preventive measures, acting quickly at the very first sign of infection, and working closely with your healthcare provider, you can greatly reduce your risk of flares and stay healthier throughout cold and flu season. Stay safe, stay proactive, and take care of your gut health.